Good evening, everyone. I am Varsha Srivastava from Bladder Wellness Team. I hope you all are keeping safe. Please vaccinate yourself and wear a mask when in a public place. Today, we are here to discuss about benign prostatic hyperplasia. It is also called as prostate gland enlargement. It is a common condition as man gets older. So, in this week, let's unite to raise awareness about the issues related to BPH and its impact in the life of people living with it. To throw more light on the subject and guide us on what's right for the diagnosis and treatment of BPH, today we have with us Dr. Ayush Khetrapal sir. It gives me an immense pleasure to introduce Dr. Ayush Khetrapal sir to you all. Dr. Ayush Khetrapal is a urologist, urologist and uro-oncosurgeon at Khetrapal Hospital, Delhi. Sir has a rich experience in the field of urology and carries out the treatment with utmost precision and efficiency, ensuring that the patient's health is in safe hands. Sir, it's a pleasure to have you in our show. We welcome you.
Good evening. Thank you so much.
So, sir, there are many things that we would like to know about BPH. So, first, we'll start with the meaning of prostate. What is prostate actually?
Prostate is a small walnut-sized gland. It is about 15 to 20 cc. It is mainly located just between the bladder and the urethra, at the junction of the bladder and the urethra, being of about I would say a small walnut-sized gland, which is usually present in the males, and patients patients during the age of I would say around at least 45 to 50 years, they tend to get the disease BPH. That is the benign enlargement of the prostate. This is what we have.
Mhm. And so, sir, what is benign this BPH, benign prostatic hyperplasia?
It's a benign disease in which there is enlargement of. It is basically the hypertrophy. The word benign prostatic hyperplasia. It is basically the hypertrophy of the gland.
Okay. And so,
Hypertrophy
why does
means,
it happen?
yeah. It usually have it is an age related disease in which most of the men, usually after the age of maybe 45 to 50 years, in maybe 60 years, they experience difficulty in passing urine, difficulty in passing urine, and many other lower urinary tract symptoms, because of which there is the enlargement.
Okay. So, sir, after how many much of age we can expect that this problem can occur in men
After the age of 50 years, ma'am.
after the age of 50 years?
25 to
So,
50, yeah.
yes. So, once the first 50 years are passed, then the later on the next second half we can say we can expect this kind of a
We can
problem and
expect.
that.
That's right.
Really,
That is
okay.
right.
Okay. So, sir, what could be the early signs or symptoms through which we can know that yes, it can be a sign of BPH?
Usually, the patients they present with two kinds of symptoms. One is the irritative symptom, the other is a storage symptom. Uh, Patients may have frequency, they have urgency, they have nocturia, they may have difficulty in passing urine, weak stream of urine, intermittency, hesitancy, feeling of incomplete wording. These are usually the symptoms in which the patient presents to us.
Okay. So any kind of abnormality while passing urine or any kind of sensation could be a sign, a red sign, we can say.
That is right.
Okay. So, sir, what can be the different causes behind it? Is it a natural process or there is a solid reason behind this particular problem?
It's mostly a natural process, mostly in the patients above the age of 50 years. Sometimes they do have these symptoms, sometimes they don't. It all depends. I mean, what kind of diet, what kind of lifestyle the patient is having. If the patient's having a good amount of liquids, if he's taking orally, what lifestyle is he having? It all depends on that.
So it is completely a natural phenomena and
It
uh,
may happen. Yes, it may happen.
sir, could we call it an age-related problem that once the patient has crossed 50 years of age, then this is something that will occur. It doesn't matter
Yes,
how, like,
it is there.
how much.
Yes, it is there.
Okay. So, sir, once we see the patient finds any kind of the signs that we have just now discussed, so what is the next thing the patient is supposed to do? he has gone to the hospital. So what are the different tests which have been conducted so he can get the surety that yes, he is exactly suffering from BPH?
Once the patient visits to the hospital, he has to see a urologist. That in particular, I mean, normally the first patient, the first doctor which usually sees the patient, which sees these kind of patients, is when the patient comes in the emergency, they are addressed by the resident doctors, and the resident doctors, they refer the patients to us, to the urologist. And
There is a network issue. Sir, am I audible? Okay, so there is a network issue. Meanwhile, the users of viewers who are connected to us, we are discussing about benign prostatic hyperplasia, and we'll try to connect with Sir. So we are discussing about BPH, that is benign prostatic hyperplasia, and we will have till now discussed about its meaning, causes, and different signs or early signs or symptoms behind it. So right now we were discussing about different tests which have been conducted, so one can get the surety that actually he is suffering from BPH. So it is, as Sir has mentioned, it is a natural phenomena, so we have to be really careful about it. Welcome, Sir, once again. Sir, you're not audible. Could you please unmute the mic?
yeah. I'm so sorry. There was some network error which
Yes.
I'm back.
Yes, sir. So we were discussing about different tests which have been conducted.
Yeah. Very unfortunate for that. Yeah. Usually, whenever the patient comes, the patient undergoes a USG, that's an ultrasound of the KOV region, along with the pre-void and the post-void, whether to see how much urine if he's holding, and how much after passing the urine, whether he's holding any urine or not. Then we go for the uroflowmetry. We can see how well is the stream of the patient. We go with the urine routine microscopy. That is just to see whether if the patient is having any urinary infection or any other thing, maybe some hematuria. And along with that, we go with the serum PSA. That is a very basic test, just to rule out if there is any blood malignancy. Oh, I mean the prostate malignancy. Yeah.
Okay. So these are the different tests which are conducted. And sir, after how many days the patient can expect the reports?
If the patient comes in the morning, he can get most of the reports by the evening.
Okay. So they
Yes.
don't have to wait for long.
No, not much.
So the viewers who are listening to us, it is a good thing actually that you will get the report. You don't have to wait for long. Okay. And sir, once these reports have come, so what is the next procedure that the patient can expect to happen?
We start the patient on a alpha blocker. I mean, it can be in the form of silodosin or alphazocin or tamsulosin, depending upon the age of the patient as well as with the sexual activity. If the patient is sexually active, we usually recommend alphazocin, and there is not much of difference between these three drugs. It is just which drug suits which person. That is it. We start with an alpha blocker, and depending upon the size, we may go with the dutasteride as well. That is it.
So, sir, whenever any kind of medicine is prescribed for any kind of a problem, not just basically BPH, so there are some or the other side effects related with the medication. So, with the medication that is provided for BPH, are there any side effects?
Yeah. Usually with alphas with the alpha blockers, the patient, they have a postural hypertension. That's why we always recommend the patient to take these medicines during the late evenings, maybe after dinner, so that these patients don't have any kind of a postural hypertension or some other, maybe some dizziness or some nausea. So it's better they take the medicine, and then they can sleep. Yeah, that's what we do.
Okay, so yes, the side effects are there, but there's nothing to worry because the solution is also there for the side effects that are present. Okay. So, sir, this disease, this problem is completely curable via medication, or in certain cases, the patient will have to go for the surgery as well.
I would say in most of the patients, it is curable with. I will not say it is entirely curable, but there is the symptoms, they do get better up to, I would say, at least 70 to 80% with the help of the medication, and the patient, they have a very good lifestyle. But the patients who are not improving on any medication, they may need to undergo surgery for
Okay.
the prostate, of course. Yeah.
But sir, whenever patient hear about the word surgery or operation, they get really scared because there are many things that goes on in their mind. They think that what if the surgery or the operation is not successful, or what if the operation is really painful? Will they be able to handle the pain? So could you please burst some of the myths related to the operation?
Surgery for the prostate is not difficult at all. I mean, there are various procedures nowadays with the. I mean, there is THULAB, there is holmium laser. I mean, with the introduction of lasers in the past, I would say at least a decade,
Hmm.
patients, there is, I mean, there we can do enucleation of the prostate with the help of the lasers, and that is very easy. That is very easy procedure. It takes about like 45 minutes to 1 hour, and the patient can go home the very next day after removing the catheter. There is not much of a pain. It is completely painless, bloodless, and the patient can go ahead with everything.
Okay. So
Yeah,
now we can say the science and technology has advanced very much, and the patient don't have
definitely,
to worry
definitely,
about. Okay.
definitely,
And
definitely.
sir, after once the surgery is performed, the operation is done. So for how many days or hours the patient is kept under supervision?
I would say 24 hours, but by next 24 hours, the patient can go home.
Okay. So for the first 24 hours, the patient is kept under supervision, and the later on he is discharged. Okay.
Exactly.
And sir, after how many days the patient can resume with the normal physical activity or the routine work?
In the next 3 to 4 days, the patient can get back to his work in the next 3 to 4 days. The patient is absolutely fine. We remove the catheter on the post of day 1, and by post of day 4 and 5, the patient can easily join back his work. That's what we can do.
So it's a very important part. Actually, I hope all the viewers are listening to us attentively. That once the surgery is performed, then also you will have to take good care of yourself. After the surgery, also after 3 or 4 days only, you can continue with the or resume with your normal activity. But please take the complete guidance from the doctor. Then only you can resume with the physical activity. So that is what is much needed actually. And sir, here comes another important part that the operation is done and the patient has got rid from the problem of BPH. But still, the chances are there that this particular problem can reoccur.
Yes, this may recur maybe in the later stage. I would say at least 10 years, 15 years down the line. Not much. I mean, the patient usually comes back to us. We regularly follow up the patient every monthly or 3 monthly, just to make sure that he's wording well, and if everything goes well and the patient doesn't have any problem, we ask him to follow up with us with the, I mean, yearly. That's what we can do. And usually the symptoms, I mean, depending upon the histopathology report, usually it comes out to be benign prostatic hyperplasia. The patient may, I mean, not many times, but the patient may have this kind of problem after maybe 10 years or 15 years down the line. Not much. Yes.
Okay. So not soon, but yes, the chances are pretty much there that this particular problem can reoccur in future. So need to be really, really careful with that. So, sir, in this case, what the patient can do so that the chances are completely minimalized, or like you can say, there are no chances for this particular problem to reoccur. Can the patient do anything?
They can just simply be on plenty of fluids. They have to maintain a good lifestyle. They have to, I mean, avoid on caffeine, avoid on tea and coffee, what I said, and just basic lifestyle and plenty of fruits, nothing else. And if he's maintaining a good healthy lifestyle, then I don't think that the patient will get these symptoms back after the surgery.
Certainly. So maintaining a healthy lifestyle, a good lifestyle will certainly keep you healthy, and any kind of disease will stay away. As many a times we hear that we must eat healthy, so we are like healthy forever, and we may not face any kind of a problem in future. Okay. So, sir, as you have mentioned just now, that caffeine intake or alcohol, all these are very much injurious, or it may be the one of the leading causes behind BPH. So, the patients should completely avoid or cut down the consumption of caffeine, or he can still have 1 or 2 cups of a coffee in a day.
1 or 2 cups won't harm. I mean, 1 or 2 cups in the morning, that should be fine. But some people, they tend to have tea or coffee. I mean, at least 4 to 5 times in a day. Maybe sometimes because of their occupation and because of their lifestyle. So we ask them to completely cut off their tea, coffee. Sometimes I would say some people do smoke, and smoking is again very bad for them. So they should stop smoking and avoid alcohol. That is the most important thing, and drink plenty of water.
Hmm. Okay. So alcohol consumption, smoking, and yes, caffeine consumption, all these are like directly, indirectly, they are linked, and they are one of the leading causes behind any kind of a problem, we can say, in a generalized way. So need to keep the patient need to keep themselves really healthy. So, sir, in this
Yes.
healthy lifestyle and like lifestyle changes that we are discussing about, so the what is the role of yoga and meditation?
They're very good. The people should do that. I mean, it is one of the lifestyle changes. And if the patient may have a sedentary lifestyle, and they are not keeping well, then they should go for a healthier lifestyle like yoga and meditation. It is very good for them.
Yes, certainly. So all these factors that we are discussing under lifestyle modification can be taken as supportive measures. For this is for all the viewers. First and foremost, as and when, as sir has just now mentioned in the beginning itself, as and when you're finding any kind of symptoms, you will have to consult the urologist and follow whatsoever remedies the doctor is providing at the right time. So you can
That's right.
save yourself from the future mishappenings. That is what is needed actually. Okay. So, sir, let's take some questions that we have got from our viewers. So, we'll take them
Sure.
one by one. So, the first one is from Jayant Deshmukh. He's asking, sir, please let me know that what are the natural ways to keep the prostate healthy?
Again, the same thing. A good lifestyle, healthy lifestyles. Avoid tea and coffee. Stop smoking if you're smoking. Avoid alcohol, and a good healthy life, a good healthy diet. That is the most important thing, and plenty of fluids. That is the most important thing. Usually, if you maintain all these things, you won't get any prostate related symptoms. But if you're an alcoholic, if you're a smoker, maybe you have a lot of caffeine, then you will get these symptoms. Maybe by the time you're in the middle age. So you should avoid all those things.
Okay. So, in the beginning, once like we are youngsters, so we are into eating lot of junk food, or we can say that into drinking
That's right.
alcohol and smoking. So later on, we can say, sir, that the body will start showing
Definitely.
the results.
Yes, that is true. That is true.
Okay. And so, what are the things or the items that we can include in our diet apart from fruits? Is there any particular drink that we need to take, like milk or something else?
No, nothing. Just a regular diet. That's it. There is nothing special. Whatever national habits. Well, I mean, our ancestors have taught us many good things. So I believe a healthy and a good diet with all the leafy vegetables, all the I mean, whatever diet you have, the natural diet which you take at home, that is good enough. I'm not saying any extra diet, something which you need to take. And everything normal, nothing extra. Yeah,
So just maintain a healthy diet and avoid any kind of alcohol or smoking. Just stay away from the negative habits or the bad habits, we can say, to keep the body healthy. Okay. And so
that's
in
right.
many of the diseases, it is seen that it is generally hereditary or genetic. That like it can be a kidney stone or something else. So this BPH is also hereditary, or there's nothing to do
No,
with the family history.
BPH doesn't need to do any with any family history. Sometimes prostatic cancer, a patient has to undergo serum PSA, has to be checked annually. So it can be there. The incident is quite less, not that much, but yes, it is there. So you have to undergo an annual health checkup in which you should include the serum PSA, the uroflowmetry. If you're getting all those things done, then you're absolutely fine. Nothing else.
Okay. So the prostate cancer would be linked with the family history, but not this BPH. BPH is a natural
Yes,
phenomenon, we can say.
it's a natural phenomenon. Yeah.
So, sir, here comes another very important topic that what is prostate cancer and what is BPH? Does BPH cause prostate cancer or these two things are completely different?
Uh, BPH is the benign BPH again. That is the benign prostatic hyperplasia. It is a benign condition, and prostatic cancer, it is a malignant condition. Usually, prostatic cancer is not that much, but in patients most of the patients who are having an enlarged prostate, they have the BPH. That is a benign prostatic hyperplasia. Prostatic cancer, they have, I mean, the symptoms are usually the same, but it is less in the incidence is less as compared to BPH.
Okay. So in both the cases, the patient need to be really careful and rush towards the hospital so the treatment can take place at the right time.
Exactly. That's right. We need to just look at the serum PSA levels, and along with that, maybe we can go with a biopsy, prostatic biopsy, to rule out whether the patient has any prostatic cancer or not. There are other investigations like MRI, MPMRI, for the just to rule out whether the patient has any prostatic cancer or not. And of course, the patient first needs to come to the urologist, and then we can rule out on based upon his symptoms and the reports whether the patient does have any prostatic cancer. But most of the patients, they just turned out to be having BP, that is benign prostatic enlargement, nothing else.
And so suppose the patient gets to know he's having some kind of symptoms or signs today, and he has started the treatment today. So how long does it take for the complete process to take place and the patient can get rid from the problem? How long is the duration?
It all depends, ma'am. Usually the patient has to, when the patient is started on the alpha blocker, it takes about maybe a year, 2 years, 3 years, sometimes a lifetime. I mean, till the rest of his life, he has to take the medication. And if the medication is fine, and he's fine, maybe down the line, maybe after 3 years or 4 years, if he's fine, we can stop the medication for a while and see if the patient is responding well, and then he doesn't need the medication. And if there is any recurrence of symptoms, maybe we need to start the medication again, just the alpha blockers. That's it.
Okay. And sir, as we have discussed that this is a natural phenomena, and once the male has crossed the 50 years of age, then he is likely to get this particular problem. So
That's
all
right.
100% men will suffer from this problem once in their lifetime, or this like there are few lucky ones also who are completely safe from this problem.
No, as I earlier said, uh, there are, I would say, at least maybe 50 to 60% of the people who get these kind of things, but not all of them. And it all depends on your lifestyle and all your habits. If you're doing all those things well, you will not have these kind of symptoms. And maybe in some patients,
There is a network error. Okay. So till now we were discussing about benign prostatic hyperplasia, and we have discussed that benign prostatic hyperplasia and prostate cancer are two different things. And we have discussed about the symptoms and the treatment as well, the primary and the secondary measures behind it. And we are trying to connect with Dr. Ayush Khetrapal sir. So we'll just try to reconnect. Till then, I hope all the viewers are listening to all the points really carefully, and they are noticing that BPH, that is benign prostatic hyperplasia, occurs once the patient or the person crosses the age of 50. So we just try to reconnect once again. Once the patient is above the age of 50, the chances are 50 to 60% that the patient is likely to suffer from BPH. So, Sir has mentioned that maintain a healthy lifestyle and maintain a good eating habit, then only you can save yourself from this particular problem. Else, you're likely to suffer from this particular problem. And here comes another important point that once you get the problem, please take the treatment. Hello, sir. Welcome once
Yeah, I'm
again.
sorry. Yeah, I think there is some network issue again and again. So I've connected by my mobile. So I hope there won't be any issue now.
It's okay, sir. It's fine. So we were discussing about BPH and how much chances are there for the people to suffer from this particular problem. Okay. Uh, and sir, that as we have discussed that this is an age-related problem that the patient who are above the age of 50 are likely to suffer from it. So the youngsters, we can say, can we conclude that the youngsters are completely safe from this particular problem?
Yes, they won't be much of a problem. I mean, of course they need during the young age they won't be having these kind of things. And still nowadays young people, they do come to us. I mean, who are especially who are alcoholics and who are smokers. They do come to us with the history of frequency and urgency. They do have this with the UTI. Patients with all these problems, when they present to us, they have recurrent UTIs, they have recurrent frequency and urgency in the urine. Despite giving the medication, sometimes they come back to us because of their I mean, they're not keeping their healthy lifestyle and their healthy habits. So I always suggest to most of my patients that yes, you have to take a good diet, you have to avoid all these kind of things. You need to maintain all these, you need to maintain a good lifestyle. Otherwise you will end up having all these problems. So you should maintain a good lifestyle. That is very important.
Certainly. And sir, as this is an age-related problem, we can say, so the patient, they think that once they are aging, so it is a natural process, and they completely ignore the symptoms, thinking that it is a part of our aging process, so we'll have to just live with it. So what
Yes.
happens once the patient ignores any symptoms and doesn't take any proper treatment?
A patient with a benign prostatic hyperplasia, they usually present to us with acute retention of urine, usually in the emergency. They usually land up early in the morning or maybe late in the night when they have something like that after I would say at least 6 to 7 hours, they can't even pass the urine. Usually they have some dribbling of urine with a weak stream, and they have a lot of pain in the lower abdomen, and they present to us with uh, retention of urine. So they need to be treated with they need to be treated with the insertion of a Foley's catheter, and then we can treat them accordingly with all the investigations, and we can just proceed accordingly. Yeah,
So at no point we can take the chance of ignoring any kind of symptoms,
that's
as
right.
it can bring some or worse results in future, and it could be little dangerous also for the patient. So that shouldn't be done.
That's right.
And sir, does this benign prostatic hyperplasia also affects our other organs once we delay in the treatment?
Yes. Patients who have difficulty in passing urine, they may suffer. I mean, if it is ignored again and again for quite some time, the patients may have the effect over both the kidneys. So they may have what do you call it? They have a fullness in both the kidneys, and after that they may have some the derangement of the renal function. So it's better whenever you have the symptoms, you should go to a urologist at least, or if the urologist is not available, at least to a local doctor. Maybe in the remote areas. Usually in the metro cities, most of the urologists are present. Maybe in the remote areas where you cannot go to a urologist, you can maybe teleconsult them, or maybe you can just go to a local doctor who can connect you to a urologist. This is what you should do.
Certainly. And so another question from our viewer, and this is from Lokesh Sharma. He's asking, how can I reduce my enlarged prostate without going for the surgery?
Just with the help of alpha blockers and dutasteride, that's it.
Okay.
This can help you.
So without the surgery, also the treatment is possible, Lokesh, so don't have to worry about it. Okay. So, sir, in the end, we have discussed many things about BPH, the causes, the symptoms, and even the proper treatment behind it. So, sir, in the end, what is the suggestion to all our viewers who are listening to you so patiently and trying to understand about BPH?
My message to everyone is the same. You should maintain a good, healthy lifestyle, drink plenty of water, avoid alcohol, avoid smoking, avoid caffeine as well, of course, and you do yoga, do meditation. It is all a national identity, a national way to have a great good lifestyle, and just be patient, nothing else.
Definitely. So, going for the proper treatment at the right time is a must. And apart from that, maintaining a healthy lifestyle can be taken as a supportive measure. So, it is not only the doctor's duty, but the duty of the patient and the family members as well. So, this is how you can keep yourself healthy and you can stay away from any kind of mental stress that comes with BPH. Okay. So once again, thank you so much, sir, for such a valuable session. It was indeed very much informative for all our viewers. Thank you so much for your valuable time, sir.
Thank you so much. Thank you so much. Have a
And
great day.
thank you to all our viewers for being so patient and asking all the questions related to BPH. We'll see you all soon in the next session. Till then, you can follow us on our FB page. You'll find us by the name of Bladder Wellness. You can also follow us on YouTube, Twitter, and Instagram by the same name, that is Bladder Wellness. This is your host, Varsha Shrivastava, signing off. Thank you so much.